Pleased again by Dr. Colleen Fogarty, the department chair for the University of Rochester Department of Family Medicine, and Chelsea Curley, the outreach and engagement specialist with Rockcovery Fitness in Rochester. Great to have you both on the show. Thanks for joining us. Doctor, I want to start with you and talk about COVID-19 and the pandemic. So much focus on this virus, and yet this hasn't stopped other issues from remaining present in our society, and that includes people that are dealing with substance use disorders and people in recovery as well, doesn't it?
Absolutely. As you know, in family medicine, we see all patients, all ages, and all kinds of conditions. And our patients with substance use disorders and in recovery have special stresses and special concerns at this time of isolation, just as others do. And I thought it was important for us to shine a light on some of those concerns today.
Chelsea, I want to turn to you. We look at the numbers, and they are troubling. March of this year, 80 reported heroin overdoses with 17 fatalities. In April, 61 heroin overdoses with 12 fatalities. Those numbers are up significantly from the same months a year ago. What is contributing to this in your mind?
You know, the weight of everything going on with the pandemic right now, you know, people are feeling isolated. People are feeling really disconnected from each other. And that's really just leading people to just want to numb out, you know, with using substances and just really engaging in that. And you're right, the numbers really just have skyrocketed since last year.
What is being done to help people in this situation?
Well, there's still a significant amount of mutual aid support groups that are happening online, on Zoom meetings, all day, every day. People can visit meetings all across the country in other time zones if they want to, which is a really cool thing. It seems like the mutual aid meetings have really taken to this virtual platform. And we at Rockcovery are still just really doing our best to connect with people. And although we can't necessarily meet with people in person, you know, we're doing our best to stay in contact through phone and through Zoom meetings, you know, get people connected to any type of, you know, 12-step meetings if that's what they're interested in.
How does open access work? Explain that to us.
Oh, Open Access is great. So they're an evaluation resource. So if anyone is really struggling right now and they're, you know, maybe thinking that they, you know, need to enter outpatient or any type of inpatient treatment, or maybe someone's even questioning, you know, do I have a problem? They can call Open Access. Someone will answer on their line. They'll get an evaluation set up right on the phone for you. And then from there, after the evaluation, they will give someone the appropriate level of care.
As we move forward with reopening here in New York, what is your message for folks that are dealing with substance use disorders and those in recovery as well, Chelsea?
I really sympathize with people who are struggling right now. You know, just because we are being asked to be physically distant from each other does not mean we have to isolate. It doesn't mean that we can't connect. It just looks a little bit different the way we're all connecting today, but the connection is still there, and that recovery is possible. It's still possible. My biggest message is that the opposite of addiction is connection. So we're here to connect with you all, and, you know, just continue to give that hope out and just encourage you to stay strong and reach out.
Powerful message. Chelsea, thank you for your time. Dr. Fogarty, thank you as well.